All right, this is an extension of the EMS Standing Orders podcast. I'm Nolan Walters.
I'm Brayden, Ballard.
We're going to Kirkwood Community College to become paramedics. We're about 3/4 of the way through. We both don't have any, we don't work anywhere in EMS, but as of now we have about 300 hours probably of clinical experience between the two of us through the paramedic program. And today we will be talking about pain medications, as well as some medication error, if we get to that. So we'll start with why do we give pain medications?
Yeah, so, people are in pain. We need to comfort them and make them not be in as much pain as possible. So we give them certain specific pain meds depending on how much pain they're in, to make them not be in as much pain.
Right, because half our job, it feels like, is make the patient more comfortable.
Yep.
But on the other half, not only making the patient more comfortable, but sometimes it can actually help the patient's symptoms. Because if you're in extreme pain, it can cause increased blood pressure, increased heart rate, even increased breathing, which can lead to your end-tidal CO2 being thrown off, which can lead to some complications.
Yeah.
So why don't people give pain medications? Because if these pain medications are so great, why don't we give them?
Yeah, so some people, some paramedics or providers.
So some paramedics, there's a couple reasons why some paramedics won't give pain medications. Number one is there's a lot of work that can go into giving pain medications. Not giving it, it's usually what comes afterwards. Not only is there a bunch of paperwork you have to fill out, but sometimes refilling the pain medication can be a hassle as well. Now, certain services like Lisbon Mount Vernon, Area Ambulance, Iowa County Ambulance, they will have a vending machine style system to refill your pain medications once you use them. Other services like Johnson County Ambulance Service, you have to go to the hospital, sometimes up to the 8th floor, to get your pain medication refilled. So that, combined with the paperwork, can lead people to not give pain meds just because of how much work it is to give it.
Yeah.
However, let's make a special note right now that never do that.
Yeah.
Your patient's care is the utmost importance. Patient care, number one priority. All the work that comes afterward is secondary to that.
Yeah.
Making sure your patient is
It's
okay.
literally your job to give them the pain meds that they need, so there's
Right.
no reason to withhold them just to make your job a little easier.
Your job is to treat the patient,
Yeah.
not to fill out paperwork. Well, technically it is, but
Yeah.
number one. The second reason why people won't give pain meds is they will label people as drug seekers. Now, sure, in certain circumstances, you could pick up somebody over and over and over again, and they could actually be a drug seeker. But especially if it's a new person you've never met before, you can't make that decision.
Right.
Like, don't withhold pain medication just because you suspect somebody is a drug seeker. So I was on a call with Area Ambulance a little while ago for a woman with a prolapsed uterus or prolapsed bladder. I forget which one it was. But we called out there, and the first thing that happens as soon as we walk through the door is the daughter of the 80-something-year-old patient was sitting outside the bathroom door where the patient was in the bathroom. And the first thing they started talking to us about wasn't the patient, but it was about why they didn't have pain medications. Because the patient had at-home prescribed pain medications, but she was trying to explain to us why they're always behind a day and all that. So sure, there probably might be some sort of drug-seeking behavior there, but this patient was on the toilet, curled over in pain, just mumbling incoherently, like they were visibly in pain. But we didn't give them any pain medication while on transport to the hospital. I didn't think anything of it at the time, but after the fact, the paramedic told me that when she ran with a different service, Lisbon Mount Vernon, they had come up with a plan with the physician at the hospital to not give pain medications to this patient while in transport. But this was with Lisbon Mount Vernon, not Area Ambulance. So
Yeah.
they did not have any standing orders to not withhold pain meds from this patient.
Right. Yeah, so by what you said, it seemed like she was in a lot of pain. And even with the orders from Lisbon Mount Vernon, I feel like she should still get pain meds because she was obviously in pain. And especially since you weren't with Lisbon Mount Vernon and you were with Area, I feel like, yeah, like if the medical director of Area told me not to give her pain meds, then sure, no pain
Right.
meds. But if it was with Lisbon Mount Vernon that they said not to, then that kind of
Right.
makes it different.
And pain pills can be a little different because pain pills will last you multiple days and all that. But working them back to the ambulance, it's a one-time thing to help with your pain med, just while in transport to the hospital.
Yeah. Also, just small doses stuff. The small doses that we give, it's a lot harder to get addicted to, I feel like.
Yes, it's like fentanyl especially, I've heard is a lot less addictive than the other like hydromorphone or stuff like that.
Sure.
So going into that, we have some stats about sickle cell disease. Sickle cell disease is a disease where normally your red blood cells that carry your oxygen around your body are donut shaped. But with sickle cell disease, they become more like a half moon, a crescent with jagged edges. This causes them to stick together to form clumps and cause lots of damage throughout your body. Some people, just excruciating pain all throughout the body. Unfortunately, 63% of nurses incorrectly think that patients with sickle cell disease are prevalent to addiction and abuse of drugs. This is a very unfortunate statistic because even though, on average, a sickle cell disease patient will go to the ER about 3, 4, 5 times in a year. Add that up over multiple years, they're in the hospital many, many times.
Yep.
And since it's always for this specific disease, they'll know what pain medications work for them.
Right.
So you combine the fact that they might be asking for specific pain med because they know what works for them, along with the fact that they might have a high tolerance to pain meds since they have this disease. Nurses will probably think that those show the same signs as somebody with a drug seeker.
Mm-hmm.
But the fact is that it should be documented in their chart
Right.
that they have sickle cell disease.
And even if it isn't, the patient's telling them that they have sickle cell. It should
Right.
be known enough by medical professionals that they need the pain meds more than other people, so their tolerances might be higher. And
Right.
yeah.
Well, is there anything else that you would like to speak on with withholding pain medications?
Not necessarily withholding, but I did want to talk about medication errors.
Okay.
So sometimes paramedics or anyone that is giving meds can just get panicked or have so much going on that they make a mistake on how much they draw to give, or on the medication that they're giving, they can accidentally give something else.
Right. At least once in your career, you're almost guaranteed to make a med error.
Yeah. Yeah, like people of any skill level, the best providers can do it. You just need to realize that you did it and know what to do after that.
Right. If you make a medication error, the first step is to acknowledge that you made a med error and tell the others around you that you made a med error.
Yeah.
Do not try to hide it.
Yeah.
At all.
'Cause if you don't, there's a paramedic in Sioux City, Iowa in August of 2023 that she had a patient that was in distress and wouldn't calm down, and she went back to the truck to get ketamine to sedate him and get him calmed down and get him to the hospital. And so she gave the ketamine and then went back to the truck to get a second dose when she realized that she actually gave him rocuronium.
A paralytic.
Yep.
Instead of a sedative.
Yeah, so that was going to kill his respiratory drive. And then he was actually complaining that he couldn't breathe to the first responders.
Because the paralytic is going to pretty much stop you from using any voluntary muscles at all. So any skeletal muscles, anything like that, it'll kill your respiratory drive, a paralytic will.
Yeah.
But the thing is, your brain won't shut off. You'll remember everything. It's just like you're paralyzed. That's what it is.
Yeah. So he couldn't breathe. I don't think the first responders did anything about that really until he went unconscious, and then they did CPR on the way to the hospital, and then that's when the paramedic finally told someone about her med error. She told the ER physician that she made a med error, like however long that was after she actually made the error.
She waited until they handed patient care to a different person before telling that she made a med error. This is why you need to tell your partners and any healthcare professionals around you that you made a med error right away, so that way everybody can be prepared for what's going to happen next. Because I'm assuming nobody knew that he was given rapironium then.
Yeah, nobody except her.
So he was just paralyzed for no reason to everybody else.
Yeah.
Which is wild to me.
Yeah.
I don't see how that could happen.
Yeah, you really gotta triple check your meds before you give them. Have someone else check for you to make sure that everything you're giving is right and everyone agrees.
Every single time whenever you give a medication, specifically very dangerous, I say dangerous medications, any medications that have big effects on the patient, so paralytics, sedatives, opiates, you always need to double check with your partner. So first double check with yourself that you have the right amount, and then you show it to your partner, make sure you got the right amount.
Yep. And then also, like I said, even the best providers can make mistakes, but you just need to know what to do after that and how to manage the patient. And you really need to tell everybody to make sure everybody knows what's actually going on.
Right. And I'll go into one more spiel. A little while ago, there was a patient, Elijah McLean. He was stopped by PD on the road, and the ambulance was called out to help them. And when the ambulance crew arrives, PD tells them that he's been super combative, and they want the ambulance crew to sedate him. So the ambulance crew does. They drop 400 milligrams of ketamine and give it to him IM. That is enough to knock you out. That is the dose for RSI, rapid sequence intubation. And I don't even think they really breathed. They didn't breathe for him. They didn't attach him to any monitors. They didn't really do anything for him. But the main point of that story is don't let non-healthcare professionals dictate or really influence what you do. We went to school for 2 years to do this job. They went to school for 2 years to do their job.
Yep.
So don't let other non-healthcare professionals influence what you do.
But that's also kind of back to the med error, because they gave so much when, like, they didn't want to give that much, did they?
I don't know if they did or not.
Okay.
But 400 is
shouldn't have.
No, I feel like they probably shouldn't have given that much.
So they let the police tell them to sedate, and then they made it a med error, so they kind of just did everything wrong there.
Yeah. Well, to wrap it up, I just want to say that my sickle cell disease information came from John Hopkins University. And to wrap it up, circling back to pain medications, it doesn't matter how much work it's going to be after the call to give the pain medications. You need to give the pain medications. Specifically, like if you're in the city, the pain medication won't kick in by the time I get to the hospital. Well, guess what? It's not going to be another 10 minutes after they arrive at the hospital that they're going to be getting the pain medication, and it's going to take another 10 minutes to kick in. So the faster it gets on board, the faster it'll start working. And if you go out into like Iowa County, 30 minutes away from the university, there's no reason not to give the pain medication if they're actually in pain.
Yep. Treat the patient, give the patient what they need. Double check meds before you give them, triple check them, have other people check them. Yeah, and just know what to do if you make a mistake and do the right thing. Tell people about it.
100%. All right, this has been an extension of the EMS Standing Orders podcast. Thanks for listening.